Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, the healthcare enrollment deadline is drawing near. We'll ensure you have the data you need to decide. Then plop and drop. No, these aren't new moves for couch potatoes, but you might want to exercise these options in retirement planning. Suffering from colds or allergies? Our advice is nothing to sneeze at. Plus, we'll meet a man with a plan to celebrate our city. And should you pay off your mortgage balance or keep the cash?
It's time to get geoing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Remember when the Affordable Care Act, also known as Obamacare, was rolling out? A big part of the plan was being able to do an apples-to-apples comparison for shopping when you're looking for your health care coverage. Now we want to ask Greg Young, how'd you like them apples? Greg is Director of Strategic Policy and Initiatives for Medical Mutual of Ohio. Welcome to the show.
Thank you for having me.
So how did the apples-to-apples comparison go?
Well, you know, that was a big point of the Affordable Care Act, having the healthcare consumer look at plans and be able to compare apples to apples. Well, it's not been that simple. A good example is the fact that when they get on the website and they look at those plans, it's very hard to get a sense of, you know, is your doctor, you know, consistent with that plan? What is the provider network like? So that's been an issue.
Yeah, that's a big one. So you've got a bushel full of tips for us, huh?
You know,
to help us
I certainly
when we
do.
go on that website to figure out what to do.
Sure. And you know, people are creatures of habit. A lot of times they like to have the same plan or something very similar to what they had before. So I think it's important that people, when they look at those metal plans, they try and find that plan that is close to what they had before, if that's what they liked. And you know, there's the platinum, the gold, the silver, the bronze. What is nice is the fact that the law really standardized the benefits. We have the essential health benefits. So when people pick out a plan, they're going to have the same, pretty much similar benefits, but the cost will be different. And if people only go with cost, they're going to miss some important things. Again, the provider network.
Okay, yeah. So when we're looking at similar plans, so there's going to be gold level plans and platinum level plans and all of that, what else are those things that we might miss out if we're just looking at the dollar amount and the level?
Right. Like I said, I think probably the most important thing is, you know, is your doctor in that plan? Is the hospital that you go to in that plan? A lot of the plans have gone ahead and they've used what we'll call, the common terminology is a skinny or narrow network, where they reduce the number of providers in order to reduce costs. So, you know, benefits don't necessarily translate into the coverage. How far do you have to drive to get to that specialist?
Oh, yeah, that's an important factor. But if you don't have access to the provider information when you're comparing those plans, how do you find that information out?
You know, Lori, that's a great question. And I think that there are people who can be relatively savvy. They can get on healthcare.gov. There are links that will take them to the insurer selling the specific plan. And I've tried that myself, and it can be difficult. But, hey, ask your provider. You know, are you on this plan? I'm thinking of buying a plan. Are you on it? Are you on the network? And also call your insurer. If, you know, be a good healthcare consumer. Ask a lot of questions.
Okay. So, and I'm betting with all this whole Affordable Care Act, there have been new insurance companies that are new to the market, some that maybe aren't part of the exchange, but Medical Mutual has been around for 80 years. You chose to be a part of the exchange.
Absolutely.
So does that mean big changes for the customers that you have, or is it going to kind of, you're trying to keep things the same?
It's been important for us as a mutual insurance company to really represent the enrollees with the company. So what we've done is we have kept our network the same. If you were with us in 2009, you would have access to the same doctors, you know, your primary care specialists, hospitals, that you would have now in 2014. I think that's very important.
Yeah, that continuity is really
Absolutely.
important. So when comparing apples to apples, you need to get to the core of the information. Follow Greg's appealing advice and find out the facts so you can be sure that you still have your same doctor and hospital. And for help, check out Medical Mutual's website. It's coming up next.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com. Next, money now or money later?